A cesarean section is an alternative way of delivering a baby to a vaginal delivery. We make an incision about the size of a baby's head on the mother's abdomen so that we can bring the baby through that incision without the trauma of having to travel through a normal birth canal. There are many reasons to do this. The most common reason is if the baby itself does not fit and labor doesn't go the way we wanted it to go. However, what you may be looking for is, why do we do a cesarean section without labor? The answer is pretty simple, but there are many reasons. So let me give you just a few. The first is, if you've had a cesarean section in the past, you run the risk of potentially rupturing your previous incision if you go through labor. So we oftentimes will do a repeat cesarean section. Secondly, there are some conditions which just require cesarean section. If a baby is not doing well from a health perspective inside the maternal abdomen, we don't want to stress the baby, and as a result, we don't want to put them through the stress of actual labor with contractions. Another reason to do a cesarean section is if there's a problem with the placenta. The placenta is imperative for the health of the baby, and if it delivers first, the baby will not survive. As a result, anybody that has a placenta previa or a vasa previa, which is the placenta being before the baby, lower in the uterus, or the umbilical cord being before the baby, lower in the uterus, will require a cesarean section.